So in a moment we're going to hear from the Minister, George Freeman, and we've already heard that he's the Life Science Minister, and uniquely in government is double-hatted. He covers both the ministerial portfolio in the Department of Health and also at the Department of Business and Innovation. And after the speech, we will then have a panel discussion, a debate, and you've got almost a prime ministerial style debate laid out for us a little later on, where we will have experts from the sector giving us insights from the four home nations. We have Deborah McNeely, the Deputy Secretary at Health Policy Group in Northern Ireland. We have Dr. Paul Rice, Head of Technology Strategy at NHS England. And we have Ivan Evans, the Deputy Director of Healthcare Technology and Innovation at the Welsh Government. And finally, Alistair Hodgson, Partnership Improvement Officer with the Joint Improvement Team in Scotland. So we have the real benefit and the richness of the different approaches and experiences of key policy leaders and shapers across the four nations of the United Kingdom. And I just want to show one or two slides to sort of set some context for the rest of today's sessions. And in a way, we're going to be spending a lot of time talking about some really wicked issues that are at the heart of some of the most tough public policy challenges in health and social care, and for that matter, housing. And they are about how we deal with the success of our society of increasing longevity, so that we have a much longer lifespan and therefore a much older population than probably at any point in society's history. And also the challenge of the rise of non-communicable diseases, of long-term health conditions. And today really is going to be about how we respond to what's going to happen in the next 9 days. Because in the next 9 days, we're going to hear a lot about the spending review. But in that context, there are some numbers I just wanted to share. And the first is this, that there are over 100,000 people who in 2048 will either have celebrated their 100th birthday or will have be celebrating it that year. Now, 2048 is the 100th birthday of the National Health Service. So today, and this event and the spending review that's coming very shortly, is all about how we ensure the NHS gets to its 100th birthday and is there to celebrate with the 100,000 plus centenarians that will be living in this country. And also, it's just worth knowing about that population when it comes to one of the real opportunities of tech. It is that we have seen over the last decade a 40% rise in the number of avoidable admissions, particularly amongst the over 65 population. This is a stat that comes from the Care Quality Commission, who've been looking at the data over that period of time. And then we have perhaps another challenge, which is that time is muscle. Now that was a picture of me taken earlier today, I should say. The facts are very clear. If you are admitted as a frail older person, the fact of the admission itself potentially can cause harm. In fact, a person over the age of 80 can lose up to 5% of their quadriceps power within the first 12 hours of their admission into hospital. So that decision to admit can have real consequences. It can be the difference between that person retaining the capability to stand unaided or indeed being on a pathway which will lead not to returning to their own home, but actually finding themselves in more intensive forms of care and support in the future. So the focus on time being muscle, the focus on making sure that we manage the flows of patients through the system is an incredibly important challenge, and one that is ever more focusing the NHS's minds. And indeed, Lord Carter, who is doing a big efficiency work program for the acute sector in the NHS, has identified delayed transfers of care and patient flow as some of the biggest operational challenges for the National Health Service. And then by 2018, the fact that there will be 3 million people living with not just one long-term health condition, but multiple long-term health conditions, and therefore requiring more complicated management and support to enable them to self-care for the majority of the time, but also to enable healthcare professionals to have a better insight into when things might be reaching crisis point and when interventions might be most beneficial. And that brings me on to the spending review. And certainly in the English context, the deal that effectively has been struck since the publication of Simon Stevens' 5-year forward view last autumn Was that 5-year forward view was offering effectively a deal. It was offering a deal which was about how to make sure that the funding gap that exists within the NHS, the £30 billion funding gap in England alone that will open up by 2020, is closed. And what he asked for was to be given an extra £8 billion by the Treasury. And in exchange for that the NHS would deliver an extra £22 billion. So I can tell you now that it's absolutely no surprise that politicians have bitten Simon Stevens' hand off to take that deal of getting £22 billion of productivity in exchange for an additional £8 billion of investment. But the real question now is whether that £8 billion will come early enough to underpin and support the transformation, the sort of changes that are required to ensure that it really does have an impact on the way in which health, social care and housing services are delivered. And also how it would in fact ensure that there is the protection necessary for various services. And as part of this deal, the £22 billion that is being identified as a key priority for productivity, that is double the productivity achieved at any point in the National Health Service's history. Indeed, it's well in excess of many other industries in our economy as well. So it is a big ask that is being brought forward. But there are also some big questions that arise from this spending review. Whether or not the £8 billion, as I say, will land early enough to be invested in a strategic way. Whether or not there will be sufficient protection for adult social care. And we've already heard that the Communities and Local Government Department has signed up to a 30% reduction in its budget, and it holds the social care budget. And also, just how realistic the asks from government will be, whether it be 724 working of the NHS and many other things that the government want to deliver from their manifesto. So this really will be a question of whether there will also be a dedicated fund to underpin and support the investment in digital health and technology. So that's what the spending review is all about, and it's also not just about England. Often it's seen as being just about what happens in the English NHS, but the funding decisions that get made have consequential impacts to every one of the home nations too. So this really is an important moment in our politics and in the way in which our health care and housing services across the 4 nations go forward. And in England, it's just worth saying that this all sits against the context of already in the first quarter of this financial year, 80% of all NHS providers, hospitals, mental health trusts and the like, have declared that they are in deficit, and that we are currently on track for a deficit well in excess of £2 billion by the end of the year. So whilst the 5-year forward view is undoubtedly an exciting rallying point that has many of the right proposals and the sense of vision for restructuring the service, there is still much to be done and many questions to be answered. And we have the opportunity of really using these 2 days to map out and get some of those questions answered. And in the end, it's really about this. It's about demand management and how we make sure that we prevent avoidable admissions, how we speed the flow through our hospitals to ensure that people get the best possible recovery, and then the right mix of support services that maintain their health and well-being and independence both before an admission and after an admission as well. And I just wanted to put this slide up, which is about culture and strategy, and how one of these business gurus, Peter Drucker, routinely says that culture, which is the, if you like, the habits, the behaviors of an organization, eats the strategy, the declared purpose, the intentions of the organization for breakfast. And I think in this quote is the heart of the challenge of delivering a digital and tech-based set of answers to the needs of patients, of carers, of service users, of clinicians within our health and care services. And I look forward to seeing us explore those over the coming days of this event. So next 2 days, we're going to hear the plans of each of the nations. We're going to have some parallel sessions where we'll have opportunities to hear from overseas too. And we will also get the chance to test whether or not the plans are sufficient to secure the efficiency gains that reports such as McKinsey have told NHS England might be possible, and whether the drive to join up records, share information, integrate commissioning and provision of health and social care will in fact support that revolution of self-management that is an absolutely key component in delivering the changes that will make the NHS and care services sustainable. That's all I want to say by way of opening remarks myself, because now what you're really wanting to hear is what the Minister has to say to us, and that's George Freeman, our Minister for Life Sciences. He's recorded a special message for this conference. He's going to be talking about the shifts that are needed. I'm going to hand over to George to address the conference. Right, so some important messages there from the Minister for us all. Focus on data, clinical information on real patients in real time, and identifying variation being a really key part of that. Strong emphasis on empowered patients and family carers too. Challenge to the sector to deliver real transactional benefits for patients, and the idea of co-production, that it's not just passive recipients of care anymore, and how that's been a really key component of the successful introduction and transformation of other industries. And then the challenges, those low-hanging fruit that need to be picked, avoiding the sort of tech risks. How do we inspire clinicians, and for that matter patients, to create the pull from them? And then the piece about empowering patients, and how do we change the default from one where tech is an afterthought rather than a forethought of those prescribing new care plans. So now we have a really fantastic panel who are going to respond to what the Minister's had to say, and then take part in a debate around some of the questions that you have helped shape through the tweet chats that have been taking place over the last few weeks. So if I can invite up again to the stage Deborah and Paul and Ivan and Alistair, please.